What if your health care, something so essential to your life, was suddenly thrown into uncertainty? President-elect Trump proposed sweeping changes to Medicaid and the Affordable Care Act, sparking fierce debates on both sides. But why did he push for these changes? Why do Republicans and Democrats clash so strongly on this? And most importantly, what's the media not telling you? Welcome to Whispers of the White House. Welcome, political savvy listeners, to Whispers of the White House. I'm your host, Dr. Heather Wisdom. I know there are countless podcasts about politics out there, but let's be honest. Most of them lean heavily to one side or the other. That's not what I want for this show. Here at Whispers of the White House, my goal is to take a different approach, an honest, unbiased one. I aim to give you a balanced view, diving into the real whys behind the stances, policies, and political maneuvers shaping our country. Why does one party support an idea and the other oppose it? What are the underlying motivations driving these debates? These are the questions we'll tackle, not with sensationalism, but with facts, reason, and an open mind. That said, I'm human. I might not always get everything right, but I welcome your feedback and corrections. This podcast is about learning and understanding, not division. So, with that spirit, let's jump into today's topic, a deep dive into Donald Trump's proposed healthcare policies from Medicaid block grants to the ongoing saga of repealing and replacing the Affordable Care Act. Buckle up, it's going to be an enlightening ride. First, let's discuss what Medicaid gets right. One of its most significant achievements is serving as a critical lifeline for over 85 million Americans, including children, low-income families, pregnant women, and individuals with disabilities. For many of these groups, Medicaid provides essential healthcare services that would otherwise be inaccessible. The program's strengths are evident in several key areas. One noteworthy advantage is the expanded coverage that has resulted from Medicaid expansion under the Affordable Care Act. This expansion has allowed millions more people to gain access to health care, addressing gaps that previously left many without coverage. Additionally, Medicaid demonstrates remarkable cost efficiency. By keeping administrative costs low and negotiating reduced prices for healthcare services compared to private insurance, it effectively maximizes resources to benefit patients. Medicaid also places a strong emphasis on preventive care. It prioritizes preventive measures such as immunizations and early screenings, which not only improve long-term health outcomes for individuals, but also help reduce overall healthcare costs in the system over time. However, despite these strengths, Medicaid faces several notable challenges. One major hurdle is the shortage of providers willing to accept Medicaid. Many doctors and specialists opt out of the program due to its lower reimbursement rates, leading to limited options for patients, particularly in rural areas where healthcare access is often already strained. This provider shortage is a significant barrier to care, as it can result in long wait times and difficulties in obtaining timely medical attention. The inconsistency in Medicaid coverage across states presents another challenge. Each state administers its Medicaid program, resulting in a patchwork of benefits and varying eligibility requirements. This inconsistency can create confusion among applicants and may leave some low-income individuals without the care they need due to differences in coverage options from one state to another. Also, while Medicaid is efficient in many areas, issues such as fraud and mismanagement persist. Billions of dollars are lost each year due to waste, fraud, and administrative errors, highlighting the need for ongoing vigilance and reform within the program. With these pros and cons in mind, it's essential to consider proposals aimed at reforming Medicaid, such as President-elect Trump's suggestion of block grants. These proposals could potentially transform how Medicaid operates, influencing funding and healthcare services delivery to millions of Americans. Now, we know what's working and what's not. Let's talk about Trump's proposal to replace Medicaid funding with block grants to states. Here's how it works. Instead of the federal government funding Medicaid directly, states would receive a fixed sum of money to manage their own programs. The argument from Trump's side? Proponents argue that this approach empowers states to customize their Medicaid programs to fit their population's unique needs, cutting through federal bureaucracy and red tape, and creating more control over federal spending and help reduce the national deficit. Supporters also argue that with a set budget, states would be incentivized to eliminate unnecessary spending and crack down on fraud. But critics warn of dire consequences. A fixed block grant doesn't account for economic downturns, population growth, or public health emergencies. It could force states to cut benefits, reduce eligibility, or impose stricter work requirements, making it harder for low-income individuals to access care. Republicans generally support this policy as a step towards smaller government and fiscal responsibility. Many Democrats, however, argue it's a backdoor effort to shrink Medicaid, ultimately leaving millions without coverage. Now here's where the conversation gets interesting. The media often focuses on the risks of block grants, and rightly so. But what's missing is a deeper exploration of the current Medicaid system's own inefficiencies and limitations. For example, while helpful, federal oversight can sometimes be too restrictive. Would greater flexibility allow states to innovate more effectively? Could a middle ground exist, one that balances federal funding with state-level autonomy? These questions are rarely asked, but they're critical to understanding whether Medicaid reform should look like block grants or something entirely different. Next, we tackle Trump's efforts to repeal and replace the Affordable Care Act, or as you might know it, Obamacare. Trump frequently called the ACA a disaster, pointing to rising premiums and limited insurance options in some markets. His administration sought to repeal the law, but the replace part of the equation remained elusive. Supporters of repeal argue the ACA overreaches, imposing mandates and taxes that stifle economic growth and individual freedom. Trump aimed to dismantle what he saw as an overly bureaucratic system with the hope of encouraging market-driven solutions. On the other side, Democrats contend that the ACA, while imperfect, expanded healthcare access to millions who previously had none. Its protections for pre-existing conditions remain popular across the political spectrum. But here's the catch. Republicans themselves were often divided. While many supported repeal on principle, the lack of a clear replacement plan created uncertainty. Key provisions of the ACA, like Medicaid expansion, had bipartisan support in certain states, complicating the picture. One perspective the media rarely highlights is how ACA repeal efforts intersect with broader healthcare industry lobbying. Insurance companies, hospitals, and pharmaceutical firms have all shaped this debate behind the scenes, often in ways the public never sees. So, why is this debate so polarizing? Healthcare reform touches on two fundamental questions. What role should the government play in our lives, and who pays the price for that involvement? Democrats generally frame healthcare as a right, prioritizing universal access and protection for the vulnerable. Republicans, by contrast, focus on cost control, personal responsibility, and limiting government intervention. Yet, beneath these ideological divides lies a common frustration: the rising cost of healthcare. What the media often overlooks is how both parties have failed to fully address the root causes, like administrative bloat, drug pricing, and fee-for-service models. For Trump, healthcare reform wasn't just a policy goal, but a campaign promise. Repealing the ACA became a rallying cry for his base, even as its implementation proved more complicated than anticipated. Meanwhile, Democrats seized on Trump's proposals to galvanize their own supporters, framing his policies as a direct threat to healthcare access. As we look back on Trump's healthcare proposals, one thing is clear: the system needs reform, but consensus remains elusive. The debate isn't just about block grants or the ACA, it's about the kind of society we want to build. Thanks for joining us for this episode of Whispers of the White House. If you enjoyed today's discussion, don't forget to subscribe and leave us a review. Next week, we'll dive into another controversial policy, so stay tuned. Until then, I'm Heather Wisdom. Take care and keep questioning the whispers.